Namboole National Stadium was set aside by government as a COVID-19 treatment unit to supplement government hospitals following a surge in the number of COVID-19 cases. Ever since the second lockdown, admissions have steadily reduced at this unit.
In the first wave, actually, Namboole admitted up to almost 2,000 patients, and all of them were discharged because they had mild disease.
The report as of 9th July 2021, Namboole Treatment Center had 1,200 beds. 40 patients were on admission. Cumulative admissions were 400 patients. 252 were discharged. 200 oxygen cylinders were available.
Each patient consumes about 1 oxygen cylinder per day.
50 patients were transferred. 20 patients had died at the facility.
Some patients come here when it is late, when they have delayed at home. So what I advise Ugandans is to come early, as soon as the symptoms develop, so that we can decide whether to admit you or to send you back home.
Treatment at Namboole is free of charge.
I've told it is government of Uganda which is funding every activity in this facility with support from partners like World Health Organization and CDC and IDI.
There is a women wing, men's wing at severe, moderate and mild level. A glimpse into the severe wing. Oxygen cylinders are assembled against patients, all struggling for their lives, while others are able to stabilize and have at least a meal for the day.
They need more of attention, and they need frequent, which is PRN, oxygen. But here they can even be removed off from the oxygen, or sometimes we put them back on the oxygen, depending on the oxygen saturation.
Relatives feed their own at the facility. It is a dire situation to look at.
So I'm in one of the rooms where COVID-19 patients are being treated from, and specifically this is a moderate room where they're being taken care of by medical experts. Now, scientists do argue that when a patient is discharged, there is no reason to test them for COVID-19. The head of Namboole National Stadium, now a treatment center for COVID-19, argues that the reason why patients are not tested upon being discharged is scientifically proven.
By the time someone has clinically improved, it means that the body has fought off the virus. So this person is no longer infectious. So they are not going to infect the people they are going to find. They may do the test, even if it turns out positive, they could still be having dead virus, which virus they are not going to transmit to any other person. So whether they are still positive or they have turned negative, it doesn't matter, so long as the symptoms have resolved.
Health workers are ever busy attending to patients. Ambulances evacuate distressed patients from wherever they are to this facility.
For those ones who are in distress and need evacuations from home, it is 0800 990000. When you call it, you'll be able to get an evacuation to this facility in case you're in distress. So we do not expect people to feel helpless and end up where they would not be able to pay costs.
But if the border brings a patient, we assume that the patient was putting on a mask, and also the border rider was putting on a mask. So we only disinfect the border, and then we don't have to keep the border rider here if he has no symptoms.
After a long day, health workers gather at this place.
Now behind me is the doffing area where this attire dressing is actually disposed of from, and according to doctors here at Namboole, they have told us that this is where many human errors occur and nurses get infected with COVID-19.
If they are not careful by following the various steps they undertake while removing the coveralls, removing the gloves, because while inside in the ward they are touching patients, so they come out when they are highly infectious. So that's why this stage is very important for extra caution and carefulness.
Temporary staff quarters have been installed to shelter medical staff at Namboole Treatment Center. PPEs for health workers, oxygen cylinders and oxygen concentrators are available. The public is advised to take advantage of Namboole Treatment Center for COVID-19 medical attention. Ivan Kahwa, UBC News at Namboole National Stadium.